Welcome back to another video. Today we're talking about seborrheic dermatitis. It is a common skin condition that mainly affects the scalp, causing dandruff and sometimes an itchy scalp. This condition is not just an ordinary nuisance. Its presence can be persistent, troubling, and sometimes even embarrassing. Despite being common among many age groups and genders, it continues to elude a definitive cure or a solitary cause. Its occurrence is primarily on the scalp, but it doesn't limit itself to that area only. The characteristics that set seborrheic dermatitis apart from other skin conditions are its unique symptoms and the areas it targets. The most prevalent symptom is the presence of a flaky scalp, often mistaken as mere dandruff. But this condition is much more than a case of persistent dandruff. The flakes are stubborn. They don't just disappear with regular shampooing and can sometimes even lead to an uncomfortably itchy scalp. The itchiness is not always present, but when is, it can lead to discomfort and a constant urge to scratch, which can further aggravate the condition. While the scalp remains the most common area for seborrheic dermatitis, is not the sole target of this relentless condition. It can also occur on other parts of the body such as the face, ears, and chest. These areas rich in oil glands provide an environment conducive for seborrheic dermatitis to flourish. The face, especially the sides of the nose and the eyebrows, are commonly affected. The condition can also extend to the ears, both on the outer ear and the canal. The chest, another area rich in oil glands, can also display symptoms. The condition's characteristics are quite distinct. The skin turns red and inflamed, often with stubborn, flaky scales that refuse to budge. These scales, often white or yellowish, adhere to the skin and the hair, creating a distinctive appearance that's hard to ignore. As for the causes behind seborrheic dermatitis, the medical community agrees that it's a combination of several factors. An overgrowth of yeast is one such factor. This yeast, known as malassezia, resides on our skin and generally causes no harm. But in certain conditions, it can grow out of control, leading to inflammation and flaking. Genetics also play a part in the development of seborrheic dermatitis, with some people genetically predisposed to this condition. It's common among people with a family history of this condition or other skin conditions like psoriasis. Stress is another contributing factor. It doesn't directly cause the condition but can exacerbate the symptoms. Certain medical conditions like HIV, Parkinson's, and depression can also contribute to its development. When it comes to treatment, it's a multi-step approach. Medicated shampoos containing ingredients like ketoconazole, selenium sulfide, or zinc pyrithione are first in line to help control flaking and reduce inflammation. These shampoos, available both over the counter and by prescription, can bring about relief. In more severe cases, the treatment protocol changes. Topical corticosteroids or antifungal may be prescribed by the dermatologist. These creams and ointments target the inflammation and the yeast overgrowth, reducing both the symptoms and the frequency of flare-ups. But treatment alone is not enough. It's crucial to follow gentle skincare practices as well. Using mild cleansers instead of harsh soaps can help maintain the skin's natural pH balance and prevent irritation. Avoiding harsh products, such as those containing alcohol or strong fragrances, can also help manage symptoms and prevent. It's essential to keep the skin clean, but overwashing or using hot water can strip the skin of its natural oils, leading to dryness and potentially flare-ups. Living with seborrheic dermatitis can be challenging, but with the right treatment and skincare routine, its effects can be managed effectively. Regular consultation with a dermatologist is necessary, as the condition can often mimic other skin conditions and self-diagnosis can lead to incorrect treatment. So, if you suspect you have seborrheic dermatitis, it's essential to consult a dermatologist for an accurate diagnosis and personalized treatment plan. Please don't forget to like, share, comment, and subscribe to my channel if you found this video helpful. Your support is essential for us to continue providing valuable content.